My name is Mead. I'm a hematologist based at the University of Oxford, and my particular area of focus is myeloproliferative neoplasms, where I see patients in Oxford, run clinical trials, and also run a research laboratory in the university. The PROMISE trial is testing a new treatment combination in patients with a form of blood cancer called myelofibrosis. Myelofibrosis is a form of myeloproliferative neoplasm. Patients suffer from a number of problems, including a very large spleen, systemic symptoms, and abnormal blood counts, including anemia, high white blood cell counts, and various other abnormalities. They often have a reduced lifespan associated with the condition, so it's quite an aggressive treatment, aggressive condition. The standard treatment associated with used in myelofibrosis is a JAK2 inhibitor called ruxolitinib. So many patients receive that as a first-line treatment, but not all patients have a optimal response. So what we like to see is the spleen completely normalizing, but in many patients the spleen remains enlarged despite dose-optimized ruxolitinib treatment. So in those patients, we know they have poor outcomes. So they have a lot of ongoing symptoms, they have a big spleen, and they have reduced life expectancy. So the aim of the PROMISE study is to take that patient group that have a kind of major unmet need for new treatment. They're already receiving ruxolitinib treatment, and it's asking the question, what is the benefit of adding in a new drug called OPN-2853, which is a BET inhibitor treatment? What is the benefit of using those two treatments in combination in this patient group? So there's really two main objectives to the study. One is to establish the best dose level for OPN-2853 in combination with ruxolitinib, to establish the safety, the side effect profile, but also to determine early signs of efficacy. The trial has enrolled 29 patients, all in the UK, at two different dose levels of OPN-2853. So the 40 milligram dose level was typically very well tolerated. So we moved up to the 80 milligram dose level, which is likely to move forward as the recommended phase 2 dose. In general, patients are tolerating the treatment pretty well. The only recurrent side effect that we've noted is thrombocytopenia, but that's easily manageable, at least across the patients on the trial. So far, the signs of efficacy are quite promising. We've seen some very nice spleen responses. These are assessed both clinically and by ultrasound scan, and patients, including my own patients in Oxford, have had really impressive spleen responses, often completely normalizing their spleen, which just to emphasize, had not properly responded to ruxolitinib treatment as a single agent. In addition to that, patients are also seeing really quite impressive symptom benefits. So we're measuring symptoms using the MPN total symptom score, and we're seeing really nice reductions with 4 out of 12 patients where we got available data in this interim analysis showing a 50% reduction in the total symptom score. The final really impressive thing, I think, about the efficacy data and the overall data on the study is the durability of the treatment. So many patients are staying on for very prolonged periods of time, which in this high-risk group of patients is really quite impressive. So if I summarize, I think the trial is looking really promising. This combination treatment is looking very promising. We're seeing really nice tolerability of the combination, durability, which speaks to both the efficacy and tolerability of the treatment. Seeing really nice spleen responses and symptom data. So hopefully this combination treatment will be taken forward into more advanced clinical development.